I want you to do something for me right now. If you're driving, maybe, wait until you stop. But if you're at home, I want you to go look in a mirror. Open your mouth, go on, really wide, pull your cheek back. What do you see?
You see teeth, hard tissues,
Right.
white enamel, pink gums.
Right. Maybe a filling, maybe a crown if you've had some work done. You see parts. You see a collection of calcified components.
Exactly.
And when one of those parts breaks, let's say you chip a molar on a popcorn kernel, or you feel that sharp, that zap of a cavity, what do?
You go to the shop.
You go to the shop, you sit in a chair, a guy in a mask comes over with a drill. He excavates the bad part.
Drills out the rust.
Drills out the rust, yeah. Patches it with some putty, sandblasts it smooth, and sends you out the door with a bill.
It is remarkably similar, almost one-to-one, with taking your Honda Civic in for body work because of a rust spot on the fender.
It is identical, and that is the analogy that kicks off this massive stack of research we've been reading all week. We treat dentistry like auto repair. We treat the mouth like it's this detached garage, completely separate from the main house of the body. You go in, you get the mechanical fix, and you leave.
Which is so strange when you really stop and think about it. If your eye started bleeding, you'd be at the ER immediately.
Oh, you'd panic. You'd think, my brain is right behind there.
Of course. But if your gums bleed when you floss, what do?
You just assume you're brushing too hard and you just ignore it.
You ignore it, yeah.
Because we've been trained, I think, to view the mouth as this mechanical zone. They're just tools for chewing. But the documents we are covering today, and specifically the visionary work coming from Victor Ronald K.M., who goes by Víck, they argued that this mechanic mindset isn't just a simplification.
It's a medical disaster.
It's a medical disaster. Víck calls it the fatal disconnect.
The fatal disconnect. That's a powerful phrase.
Isn't it? And his proposal is, we need to fire the mechanic and hire a biologist. So today, we are diving into the world of vegan dentistry.
And we have to stop right there, because I know what you're thinking when you hear that.
I know. I rolled my eyes when I saw the title, Vegan Dental Inc. I really did. I thought, great. Are we talking about kale-flavored fluoride? Is the waiting room furniture made of hemp?
Right. It sounds like a lifestyle brand.
Yeah.
Or just a dietary preference that they've slapped onto a dental practice. But that is a massive misdirection.
It really is. We need to dispel that myth immediately. This isn't just about no meat or, what the dentist eats for lunch. The deep dive today is about a holistic paradigm shift. A huge one.
It really is. We're talking about combining high-tech physics like MRIs and AI with microbial ecology and a very deep, almost philosophical, ethical framework.
It's a convergence. You have the ethics of ahimsa, or non-harming, colliding with the hard science of what they call the oral gut-brain axis.
So it's not just about saving animals, although that is a huge part of it. It's about saving the patient from systemic inflammation and toxicity.
The mission statement here is wild. It's to establish dentistry not as this side toolbox for your teeth, but as a neurological and immunological gateway to the rest of the body.
Which just makes sense, right?
Yeah.
The mouth isn't Las Vegas. What happens in the mouth does not stay in the mouth.
Oh, I love that.
It enters the bloodstream, it enters the gut, and it enters the nerves.
The mouth isn't Las Vegas. That's really the roadmap for today.
Yeah.
We are going to go deep on this. We are going to look at the hidden animal products in your current dental work stuff that, and I'm not kidding, it genuinely shocked me. It actually made me feel a little sick.
It's pretty jarring.
We are going to track how bacteria from your gums end up in your brain and are being linked very strongly to Alzheimer's.
And we're going to talk about why your standard x-rays are missing these silent infections that might be draining your energy for years without you even knowing it.
And then, this is the craziest part to me, we are even going to talk about governance. We're going to talk about how to restructure the business of healthcare using a DAO, a decentralized autonomous organization.
Yeah. It's a lot to cover. It's a big, big topic.
It is a massive stack. So let's start at the foundation. The ethical and material foundation of this whole vegan dentistry concept. The central philosophy that keeps coming up in the documents is ahimsa.
Ahimsa, right. It's a Sanskrit term,
Yeah.
an ancient principle. And it's usually translated as, nonviolence or non-harming.
Okay, so like the Hippocratic Oath. First, do no harm.
Sort of, but it takes it much, much further. The Hippocratic Oath is usually interpreted as, don't harm the patient sitting in the chair right now. It's very focused.
Right. The person in front of you.
The person in front of you.
Yeah.
Ahimsa, in this framework, It extends that circle of compassion. It says we shouldn't harm the patient, obviously, but we also shouldn't harm animals to treat the patient, and we shouldn't harm the planet to treat the patient.
So it's challenging that anthropocentric view of medicine, the idea that human health justifies any cost to other living beings.
Precisely. And that's the perfect lead-in to what they call the parts list.
Ugh, the parts list. Because when I read this section of the source material, I think it was around page 12, I had a visceral reaction. I think most people, myself included, assume that dental materials are just sterile chemicals.
Right. Metals, plastics, ceramics. You think of a lab, not a farm.
But the sources pull back the curtain on this, and it's called the yuck factor for a reason. Let's talk about what is actually in people's mouths right now.
It is genuinely surprising. I mean, conventional dentistry relies heavily on animal-derived tissues. The most common one, and the one that shocks patients the most, is bone grafts.
Okay, so walk me through this scenario. I get a tooth pulled. The dentist says, okay, we're going to need to do an implant later, but first we need to build up the bone in that spot.
Right. The bone resorbs after an extraction, so you need to fill that space.
Where does that new bone come from?
Well, very often it's what's called a xenograft. Xeno, meaning foreign. And the industry standard, brands like Bioos is usually bovine.
Bovine.
Cow bone.
Wait, hold on. You're telling me if I walk into a dentist today for a standard procedure, they might put a piece of a cow in my jaw, like from a slaughterhouse?
Yes. They take the bone, usually the femur, from cattle. They process it. They strip all the organic material off. They heat it to incredibly high temperatures to sterilize it. And they turn it into these little granules.
Wow.
And it acts as a scaffold. The whole idea is that your own body will see this mineral structure and it'll build new bone all around it.
So you could literally have a cow skeleton inside your face.
Essentially, yes.
Yeah.
A small part of one.
Does the patient know this? Because I feel like I would remember signing a form that said, I consent to having a cow femur inserted into my head.
I mean, it's usually listed in the fine print. It'll say natural bone mineral or xenograft. But most patients don't ask, hey, what does xeno mean? They just assume it's synthetic, it's something made in the lab.
That is just wild, but it doesn't stop at the bone, does it? To protect that graft, they use a barrier membrane.
Correct. You need to contain the graft so the gum tissue doesn't grow into it too fast. And those membranes are very often made of porcine collagen.
Porcine meaning pig.
Pig skin or connective tissue. Sometimes it's even the pericardium, the sac around a pig's heart.
Okay, so just to recap the turducken situation we have going on here, you have a cow bone wrapped in a pig heart, stuffed inside a human jaw.
It sounds grotesque when you put it that way, but yeah, that is the standard of care in a huge number of dental offices today.
And the list just keeps going. Sutures, if you've ever had stitches in your mouth that dissolve on their own.
There's a good chance those were gut sutures, which sounds like a nickname, but it's completely literal.
It is literal. You're kidding.
No, it's made from the submucosa, the inner lining of sheep or cattle intestines. The body breaks it down because it recognizes it as protein.
Unbelievable.
Or, if they use non-dissolving silk sutures, that's from silkworms, an insect product.
And it's even in the basic hygiene products, the stuff we use to clean our teeth every day. I saw glycerin on the list in the report.
Glycerin, yeah. It's in almost every toothpaste to keep it moist and give it that smooth texture. It's very often derived from tallow,
which
rendered animal fat. Same with stearic acid, which is often in the polishing paste the hygienist uses on you, often from animal fat.
The one that really got me was the fluoride varnish. You know that sticky stuff they paint on your teeth at the end of a cleaning? Stuff that feels like you have a sweater on your teeth for the rest of the day?
Yeah, shellac.
Shellac, which I thought was just a type of finish you put on antique furniture.
It is a resin.
Right.
But do you know where it comes from? It's secreted by the female lac bug. So it's an insect secretion.
Oh, that's horrible.
And if your toothpaste or mouthwash has that bright red or pink color...
Don't tell me. I don't want to know.
It's probably carmine, which is a pigment made from crushed cochineal insects.
So they crushed beetles to make the toothpaste look pretty. Okay, so there is definitely a huge yuck factor. But the argument that Víck and the source material are making isn't just this is gross, it's an ethical conflict, right?
It's the means to an end argument. The standard medical model views animal bodies as a warehouse of spare parts, basically. We need bone, take it from a cow. We need collagen, take it from a pig. In the vegan dental model, this is just ethically indefensible. The core idea is that you cannot build health on a foundation of exploitation.
But is there a functional argument too? Because I can hear the skeptics and, frankly, the pragmatic part of me saying, well, If cow bone works best, isn't that what matters? If it heals the patient, isn't that the #1 priority?
And that's the pivot point. That's where this whole thing gets really interesting because the sources argue that we don't need these animal parts anymore. We have moved past that. We have things called alloplasts. They're
Alloplasts.
fully synthetic grafts. We're talking about things like calcium phosphates, bioactive glasses, or even, and this is really cool, plant-derived materials like polymers from algae.
And what's the argument for them being better?
Well, the expert insight here is crucial.
Hmm.
These synthetic materials can actually offer superior biocompatibility.
How so? I mean, if the cow bone is sterilized and all the organic stuff is gone, isn't it just neutral minerals at that point?
Not entirely. Even when it's highly processed, there is still a risk of an immune reaction. The body is incredibly smart. It has this complex system for knowing self versus non-self.
Okay.
When you put a xenograft in, your body might still see it as foreign. It might encapsulate it. You get what are called giant cells, these big immune cells swarming it. It's a low-grade, chronic foreign body response.
So instead of fully integrating and becoming part of you, your body is kind of fighting a cold war against the graft for years.
Exactly. Whereas these new synthetic materials can be engineered to be chemically identical to your own bone mineral. So you reduce that risk of rejection, you reduce that chronic inflammation. It's cleaner, it's more consistent, and it carries zero risk of transmitting any animal diseases, which is another small but real concern.
And this all ties into the other pillar of the ethical foundation, which is the rejection of animal testing. They talk about the 3 R's.
Right, the 3 R's, replacement, reduction, and refinement. But vegan dentistry pushes hard, really hard for replacement. Historically, every new dental material, every new adhesive was tested on animals, usually beagles or rodents.
Which is just heartbreaking when you think about it. I mean, beagles are the sweetest dogs.
It's awful. And the thing is, scientifically, it's becoming less and less relevant. We now have organ-on-a-chip technology.
What is that?
We can simulate human gum tissue or bone response on a microchip in a lab. We can build a little model of a human system. We also have in silico computer modeling that can predict toxicity. We don't need to sacrifice a beagle anymore to see if a filling material is safe. The technology has outpaced the cruelty.
So we're stripping away the animal products, we're stripping away the cruelty, but that's just the materials. The real meat of this deep dive, pun intended, or maybe unintended, I guess, is the biology.
The biological superhighway.
The oral gut-brain axis. This is where that mechanic mindset just completely falls apart because a mechanic fixes the engine, and that has nothing to do with the tires, but in the body.
Everything is connected.
Everything is connected. Let's start with the mouth as its own ecosystem.
We have to understand that the mouth is the second most diverse microbial community in the entire body.
Yeah.
Right after the gut. It is a jungle in there. I mean, hundreds of species of bacteria, viruses, fungi, and it's not static. It's constantly changing.
The source dropped a stat that's just, it blew my mind. We swallow how much saliva a day?
It's a shocking amount, between 0.5 and 1.5 liters. Every single day.
That's a big water bottle of spit.
It is a full Nalgene bottle of spit.
Yeah.
And that saliva isn't sterile. It is teeming with bacteria. We're talking billions of them with every swallow. So you are constantly seeding your gut with whatever's growing in your mouth. You are swallowing your oral microbiome 204/7.
Now, normally the stomach acid is supposed to handle that, right? It's like the bouncer at the door of a club.
Ideally, yes. The stomach acid is a firewall. It has a very, very low pH, and it's designed to kill off pathogens before they get any further. But there are two big problems here.
Okay.
One, if you are taking antacids, things like Tums, or especially the stronger PPIs for heartburn, you've lowered that firewall, you raise the pH, the bouncer's drunk.
So more guys get into the club.
Exactly.
Yeah.
And two, if you have dysbiosis, which is just a fancy word for an imbalance in the mouth, like gum disease or periodontitis, the sheer load of bad bacteria you're swallowing is just too high for the stomach to handle.
They storm the castle.
Essentially, yeah. This leads to something called ectopic colonization, a great term. It just means oral bacteria end up setting up camp where they don't belong. They colonize the gut.
And this isn't just, oh, my stomach feels a little weird. This connects directly to the leaky gut concept, which I feel like I hear about everywhere now, but I don't think people fully understand it. How does mouth bacteria cause leaky gut?
It's a physical degradation of the gut lining. We're talking about specific pathogens here, like Porphyromonas gingivalis or Fusobacterium nucleatum.
Okay, those are the main villains in this story.
They're the main villains. When these guys survive the stomach and they set up shop in the intestines, They produce enzymes that attack what are called the tight junctions.
Tight junctions.
So think of the lining of your gut like a perfectly laid tile floor. It's supposed to be sealed. The grout lines between the tiles are the tight junctions. They're made of proteins, and they keep all the food particles and bacteria inside the gut and out of your bloodstream.
Okay, so it's a barrier.
It's a critical barrier.
Yeah.
And these bacteria, they literally eat the grout. They degrade those proteins and increase what's called intestinal permeability.
They punch holes in the wall.
Microscopically, yes.
Yeah.
Tiny little holes.
Mm.
And that allows things that should stay in the gut to leak out into the bloodstream. Specifically, something called endotoxins, or LPS.
LPS. This is the stuff that triggers the big-time inflammation.
It's like pouring gasoline on a fire. LPS lipopolysaccharides are parts of the cell wall of these bacteria. Once LPS gets into your blood, your immune system freaks out. It goes on high alert. This causes chronic, low-grade systemic inflammation. And the sources link this directly to things like IBD, inflammatory bowel disease, and even colorectal cancer.
So let me get this straight. You have gum disease, so you have bad bacteria in your mouth.
Yep.
You swallow them. They survive your stomach because you're taking heartburn meds. They get to your gut, and they eat holes in the lining.
Right.
Your gut then leaks these bacterial toxins into your blood, and now your whole body is inflamed just because you didn't floss properly.
That is the oral gut connection.
Hey.
It is a direct causal cascade, but it goes further. It goes upstream to the brain.
The Trinity. Oral gut brain. This is the part that I think scares people the most. It certainly scared me, but it's so important to understand. The Alzheimer's connection.
It is startling. The evidence is becoming very, very strong. Researchers have found oral pathogens inside the brains of deceased Alzheimer's patients.
Bacteria from the gums found in the brain tissue itself.
Yes, specifically that one we mentioned before, P. gingivalis. And here's the really specific part. This bacteria produces these toxic proteases called gingipains. Think of them as molecular scissors.
Okay, and what are they cutting up in the brain?
They're cutting and damaging crucial proteins. In the brain, these gingipains have been found co-localized, sitting right next to the amyloid plaques and tau tangles.
Which are the two definitive hallmarks of Alzheimer's disease.
Exactly. Now, for a long time, the thinking was that the amyloid plaques were the cause of the disease. They were the bad thing. But there's a new theory emerging called the antimicrobial protection hypothesis.
Okay, and that is?
It suggests that the plaque might actually be the brain's defense mechanism.
Wait, so the plaque is the brain trying to protect itself from something?
Yes. The theory is that the brain produces the beta-amyloid protein to trap and neutralize invading microbes, like P. gingivalis. It's trying to quarantine them. It's building a sticky wall around the invader.
But the side effect of that war
is massive collateral damage. The chronic inflammation from this battle eventually destroys the neurons around the plaque. So the plaque is the evidence of the fight, not the initial cause of the fight.
That is terrifying. But also, it's kind of hopeful, isn't it? Because it suggests a tangible cause. It means if we can stop the bacteria from getting into the brain in the first place, maybe we can stop the plaque from ever forming.
That is the radical implication, yes.
So how are they getting there? The brain is supposed to be protected, right? The blood-brain barrier.
It is. But there are two main routes they can take. The first one is through the blood. If you have leaky gut or even just really inflamed gums that bleed when you brush, the barrier is broken. The bacteria get into the bloodstream. And if the blood-brain barrier itself is already compromised, which happens with chronic inflammation, they can slip right in.
And the other route
is even more direct. It's the nerves, specifically the trigeminal nerve. It's a massive cranial nerve that connects the jaw, the face, and the mouth directly to the brainstem. It's possible the bacteria can travel along these nerve fibers like a superhighway, completely bypassing the bloodstream and the blood-brain barrier.
So the big takeaway here, the expert insight, is that gum disease isn't just a risk to your teeth anymore. It's a direct risk to your cognitive future. You aren't just flossing to save a molar from a cavity. You're flossing to protect your brain from dementia.
Precisely. It reframes the entire act of oral hygiene.
So we've painted this terrifying picture of bacteria invading our guts and our brains. But the source material doesn't just leave us in the horror movie. It offers a solution. And it starts not in the dentist's chair, but at the dinner table, with what we put in our mouths.
Part 3. Nutrition as the primary preventative tool.
And of course, since this is vegan dental, the focus is on a whole food, plant-based diet, or WFPB. But again, it's not just eat your veggies because mom said so. It's deeply biochemical.
It's nutrition as medicine. The source argues pretty convincingly that diet is the single most powerful modulator of the microbiome. You can change your microbial populations in a matter of days just by changing what you eat.
And it all comes down to one word, really.
Fiber.
Fiber, which animal products have absolutely zero of.
Zero fiber in meat, dairy, or eggs. It's exclusively a plant-based nutrient. But plants are fiber-rich. And here's the thing. When you eat fiber, you aren't really feeding yourself. You're feeding your gut bacteria.
You're feeding the good guys.
You're feeding the good guys. And when those beneficial bacteria feast on fiber, they produce a byproduct. They produce SCFAs, short-chain fatty acids.
And the star of the show here, the one they talk about constantly, is butyrate.
Butyrate is magic. It's a powerhouse molecule. First, it's the primary fuel for the cells lining your colon. It directly heals the gut lining, reversing that leaky gut we talked about. It regrouts the tile, so to speak.
Good, so it seals the barrier.
It seals the barrier. But it also gets absorbed into the bloodstream, and it travels throughout the body. It gets to the brain, where it has been shown to reduce neuroinflammation. And get this, it strengthens the blood-brain barrier.
So eating a salad creates butyrate, which builds a stronger wall around your brain to keep the bad guys out.
That is a perfect way to put it, yes.
There's another pathway mentioned that I found absolutely fascinating because I love leafy greens, the nitric oxide pathway.
This is a beautiful example of the symbiosis between us and our bacteria. We literally cannot live without them. So here's how it works. You eat spinach or arugula or beets, they are super high in nitrates.
Right.
Your body itself can't really use nitrates directly.
Yeah.
But there are specific bacteria that live on your tongue, mostly on the back of your tongue. And their job is to convert that nitrate from your food into nitrite.
Okay, so the tongue bacteria do the first step of the conversion.
They do step one. Then you swallow your saliva, which is now rich in nitrite. And when that nitrite hits the acidic environment of your stomach, it gets converted into nitric oxide, NO.
And what does nitric oxide do for us?
Oh, it's incredibly important. It's a powerful vasodilator. It relaxes and opens up your blood vessels. This lowers your blood pressure, it protects your heart, it improves blood flow to all your organs, it even improves athletic performance.
So wait, my oral bacteria are directly involved in regulating my blood pressure.
They are essential for it. And here's the kicker from the research. If you use a strong antiseptic mouthwash, the kind that burns, the kind that promises to kill 99.9% of germs.
You're killing those good bacteria on your tongue. You're wiping out the factory.
You are carpet bombing the entire ecosystem. And studies have shown that using a strong chlorhexidine mouthwash can actually raise a person's blood pressure within hours because you've shut down this nitric oxide production pathway.
That is wild. It's like we're waging war on our own allies without even knowing it.
We are, and the plant-based diet supports this whole pathway, whereas an animal-based diet. Well, let's talk about inflammation again.
Right, the anti-inflammatory effect.
So animal-based diets, which are typically high in saturated fats, are pretty consistently linked to higher levels of systemic inflammation. But we also have to talk about a specific molecule called TMAO. When you eat red meat or eggs, there are compounds in them called choline and carnitine. Certain gut bacteria process those into a gas called TMA. Your liver then converts that TMA into TMAO.
And TMAO is bad news.
High TMAO levels in the blood are strongly linked to heart disease, stroke, and vascular inflammation. It makes your blood vessels sticky.
So the vegan advantage here isn't just ethical. It's that you're flooding your body with fiber and polyphenols and antioxidants to dampen the fire of inflammation.
Right.
Versus pouring gasoline on it with saturated fats and precursors to TMAO.
Precisely. It's about creating an internal environment, a terrain, if you will, where health can thrive, rather than constantly having to fight off inflammatory triggers from your food.
So we've covered the ethics, the biology, and the fuel. This is amazing. Now let's talk about the tools, because this is where the technological renaissance comes in. And the source material just slams X-rays. It calls them the mechanics tool.
It's a very fair criticism.
Yeah.
I mean, think about what an X-ray actually is. It's a shadow picture of hard things. It shows mineralized structure.
Or scaffolding.
The scaffolding. It shows you if the wall is standing. It does not show you if the insulation is moldy or if the pipes inside the wall are leaking. Plus, X-rays use ionizing radiation. It's a low dose, sure, but it's cumulative over a lifetime.
Okay, so if X-rays are out, what's the alternative? The source points to MRI.
Magnetic resonance imaging. And we usually think of MRI for, a torn ACL in your knee or for looking at the brain, but the move here is to start using it for the jaw.
And why? What does an MRI show that an X-ray completely misses?
The word they use is vitality. An MRI shows fluid. It shows blood flow. It shows inflammation. It shows soft tissue. This is absolutely crucial for detecting the silent killer that's mentioned all over the report, FDOJ.
FDOJ, fatty degenerative osteonecrosis of the jawbone. That is a mouthful.
It is. So let's break it down. Osteo means bone. Necrosis means death, so it's dead bone. Basically, it's a hollow space inside the jawbone where the marrow has died and turned into this fatty, oily, toxic mush.
And this happens where? Like where in the jaw?
Very often in old extraction sites. The most common place is where your wisdom teeth used to be. The gum heals over the top perfectly, but the bone underneath never filled in properly.
But wouldn't my dentist see a big black hole in the bone on the X-ray?
And that's the stealth aspect of it. The outer shell of the bone, the cortical plate, often heals over and looks completely normal and dense on an X-ray. It looks solid. So the dentist looks at the film and says, everything looks great, you're fine. But inside, it's rotting.
It's a toxic dump site hidden behind a nice-looking wall.
That is a perfect analogy. And because it's not an acute infection, it's not a pus-filled abscess that hurts like crazy, it's silent. The patient feels no pain there. But that site is pumping out inflammatory toxins, specifically a chemokine called Rantase, or CCL5.
Rantase. I've heard of this in relation to cancer research. It's a bad one.
It's highly inflammatory. It attracts mast cells. And high levels of Rantase have been linked to a whole host of systemic problems. Autoimmune diseases, breast cancer, multiple sclerosis, and especially chronic fatigue. Patients walk around feeling exhausted, sick, and inflamed, and their doctors can't find the cause because their jaw looks fine on a standard X-ray.
And the MRI can see this sludge.
The MRI sees the lack of blood flow. It sees the edema, the fluid. It sees the fatty degeneration. And what's really next level is they're integrating AI, artificial intelligence, to scan these density patterns on the MRIs to predict systemic risks. It turns the jawbone into a diagnostic dashboard for the entire body.
That is incredible. So we find the problem with the MRI. Now, how do we fix it? We've talked about avoiding animal parts for grafts, but there are other common materials the source goes after, specifically mercury and titanium.
Yes, this is where they talk about the SMART protocols. Let's start with amalgam fillings, the old silver ones. They're about 50% mercury by weight.
Which is a known neurotoxin. I mean, we don't put mercury in thermometers anymore, but we have it in our teeth.
It is a massive controversy that's been raging for decades. But the vegan dental approach says, look, regardless of the debate on whether the filling is safe while it's just sitting there, removing it is definitely dangerous if it's done wrong.
Right, because when you drill it, you heat it up.
Exactly. Friction creates heat. Heat creates vapor. If a dentist just takes a drill to a mercury filling, you are creating a cloud of mercury vapor that the patient and the dentist and the assistant inhales. It goes straight to the lungs and into the blood.
So the SMART protocol is what? They wear hazmat suits?
Pretty close. It stands for Safe Mercury Amalgam Removal Technique. You have to use an oral Damon, a rubber sheet, that seals off the tooth from the rest of the mouth so you don't swallow particles. You give the patient a separate air supply for their nose. You use high-volume vacuum filtration right at the source. You basically treat the tooth like a tiny little hazmat site to protect the patient from acute mercury poisoning during the procedure.
And then implants. The standard for decades has been titanium. It's strong, it's biocompatible. Why change it?
Well, titanium is a metal. The mouth is a saline environment. It's full of salty water, your saliva. What happens when you put two different metals in salt water?
You get rust. Or, no, wait, you create a battery.
It's electricity. It's called galvanism. It creates a battery effect. If you have a gold crown on one tooth and a titanium implant on another and saliva in between, you've literally created a battery. There is a measurable electric current.
And that current does what? Just shocks you.
It's usually not that strong, but the source argues that this constant, low-level electrical current can disrupt the body's own nervous system, which runs on electrical signals. It creates noise in the signal. It's subtle, but it can contribute to things like headaches, fatigue, and neurological stress.
So what's the alternative to titanium?
Zirconia. It's a ceramic. It's white, so it looks much more natural like a tooth root.
Yeah.
But the most important physical property is that it's non-conductive. It's electrically neutral. And interestingly, research shows that the soft tissue, the gum, actually bonds to zirconia much better than it does to titanium. It creates a tighter, healthier seal against bacterial invasion.
So we've rebuilt the mouth with ceramics and composites, we've cleaned up the diet, we've scanned with MRI, we've covered the ethics, biology, and technology. Now we get to the most unexpected part of this entire outline for me. Governance.
Part 5, the governance model.
I really did not expect to see the acronym DAO in a dental report, a decentralized autonomous organization. I mean, usually I hear about that in crypto podcasts. Why is blockchain technology in a dentistry deep dive?
It sounds totally out of place, doesn't it? But think about the core problem with the traditional dentistry model that's outlined here. What is the fundamental incentive structure?
It's drill and fill. You get paid for procedures, you get paid to fix things when they break.
Exactly. The corporate structure, especially in larger dental chains, often prioritizes profit margins and shareholder value. If a patient gets perfectly healthy and never needs another procedure for the rest of their life, the business loses money. That is a fundamentally misaligned incentive.
The mechanic only gets paid when the car breaks down.
Right. So how does a DAO fix that? A DAO moves the governance structure onto the blockchain. Instead of having a CEO and a board of directors whose legal duty is to maximize profit for shareholders, the protocol itself is owned by the community.
By the patients.
By a board of patient advocates, holistic practitioners, scientists, and the community of patients itself. They would hold tokens that give them voting rights on the direction of the organization.
So the owners of this system are the same people who are receiving the care.
Right. And what does that do? It completely shifts the incentive. The goal is no longer to maximize procedures. The goal becomes maximize biohealth. If the community owns the protocol, what do they want? They want what actually works. They want true prevention. They want data privacy. They want to fund research into plant-based materials and safer protocols.
It's radical. It's basically saying, we don't trust the old medical industrial complex to prioritize our health over its profits, so we're going to build our own parallel structure from the ground up.
It is the ultimate expression of taking control. Just as you take control of your diet with veganism and you take control of your biology with these advanced protocols, you are now taking control of the very administration of your healthcare. It combines high-tech biological medicine with high-tech social organization.
This has been a massive journey. I mean, we've gone from crushed beetles and toothpaste all the way to blockchain governance. Let's try to bring this all home. The outro in the material talks about the One Health concept.
One Health is the synthesis. It's the big picture realization that you cannot separate human health from animal health or from environmental health. They're not separate issues.
They are three interlocking circles.
And vegan dentistry, as it's envisioned here, sits right in the center of that Venn diagram. By choosing biocompatible, non-toxic materials, you help human health. By rejecting animal products and animal testing, you help animal health. And by choosing sustainable, plant-based nutrition and materials with a lower carbon footprint, you help environmental health.
It's a unified theory of care.
It is.
And it completely redefines the job description of a dentist. The dentist isn't a mechanic anymore.
No, not at all. They become a systemic health navigator. The mouth becomes the mirror of the body. If you have inflammation in your gums, it's a huge red flag that you likely have inflammation in your arteries. If you have acid erosion on your teeth, you might have GERD or other gut issues. The dentist is often the first person in the entire healthcare system to see these early warning signs.
And with these new tools, the MRI, the nutritional counseling, they have the ability to actually address the root cause, not just patch the symptom in the mouth.
That's the entire key.
Yeah.
Treating the root cause, not chasing symptoms.
I want to leave the listener with the provocative thought from the end of the source material. It really, really stuck with me.
It's a powerful question to sit with.
If the jawbone is a sentinel for the entire body, if it holds these silent infections, if it reflects our systemic inflammation, how many so-called medical diseases are actually dental problems in disguise?
How many cases of depression or heart disease or arthritis or especially chronic fatigue are actually being driven by a hidden, smoldering fire in that space between the nose and the chin?
It makes you look at your toothbrush in a whole new light.
On your lunch.
In your lunch, right? Your next meal isn't just fuel, it's neuroprotection. It's building the wall around your brain.
It's all connected. It truly is.
We really hope this deep dive gave you a lot to chew on. Pun definitely intended this time. This is a rapidly evolving field, and the vision laid out by Víck and Vegan Dental Inc. is, well, it's definitely pushing the boundaries of what we think dentistry is and what it could be.
It's a fascinating glimpse into a future where going to the dentist might just save your brain.
Thanks for listening. We'll catch you on the next deep dive.
Stay curious.